Hi, I'm Dr. Angela Riley. I'm the medical director for Unite Here Health, and I wanted to spend some time to speak to you about the COVID-19 vaccine. I'm sure many out there have a lot of questions and really aren't sure what to expect with the vaccine. So I wanted to share some information with you just so that you can be better prepared to make that decision. And my biggest point I really want to make is although the vaccine might be scary, it's really the only way out of this pandemic. It's really important that everybody learn everything they can about the vaccine and that we get as many people vaccinated as possible so we can get back to our jobs and our lives and life as we knew it before the pandemic. So hopefully this will help share some ideas and clear up some of the questions that you might have about the vaccine. So many of you have had vaccines in your life. Your children have been vaccinated, and I'm sure you were all vaccinated as children as well. But do you really even know what a vaccine is? So, vaccines are kind of like a medicine. They're providing our bodies with a set of instructions to tell our cells how to fight off a disease. And they do this without making us sick in the process. And vaccines have been around a really long time, and every year they save millions of lives around the world from diseases that would otherwise kill them. And things like smallpox have almost been eliminated from the face of the earth because of vaccines. And without vaccines, the only way to stop certain diseases from spreading is for everyone to get sick. And vaccines have really been a way to prevent that from happening. They've been around for almost 150 years. And without everybody getting sick, vaccines really provide a very important part in stopping the spread of disease. The COVID-19 vaccine, a lot of people are worried because it seems so new and it came so fast. And why is that? Well, the COVID-19 vaccine actually uses a different technology than most of our other vaccinations. And this vaccine technology has actually been around for a long time, for almost 20 years. And they've been working on it for a long time. So it's not like they just came up with it overnight. But it's very good technology that's very aligned with how the COVID-19 virus works. And that's why it's been so successful. So, what the COVID-19 vaccine does is it has a set of instructions, just like other vaccines, but it contains a set of copycat instructions that tell our cells how to code for these little spiky proteins that are on the outside of the COVID virus. And you've all seen what the COVID virus looks like. It's on the news all the time. It has these little spiky things off of it. These are proteins. And when these proteins are presented to our body, that is what sets the immune system in our body to start working. And it causes a lot of inflammatory chemicals to be released into our body. And this is what makes us feel so sick. So, what the instructions do is they tell our body how to make this spike protein that's on the outside of the COVID virus. This goes into the vaccine, which is injected into our arm, and the set of instructions is presented to our cells to tell them how to make this protein. Well, once those instructions are done and our body has made them, then our body gets rid of them. So the COVID vaccine doesn't even stay in our body once the body has learned how to make the proteins. When the proteins are made, then antibodies are produced, and that tells our bodies how to react to the COVID virus if we become infected. At no point is there any part of the COVID virus that ever enters our body through the vaccine. So there's really no way you could ever get the COVID virus from the vaccine itself. Also, the set of instructions, they enter your cell, but they never enter the nucleus of your cell where the DNA is contained. So there's absolutely no way for the COVID vaccine to change your DNA. It really is just providing a set of instructions on how to fight off the virus. And how do vaccines work besides just affecting one person? Well, one thing that's really important for everyone to know is that vaccines help with what's called herd immunity. I don't know how many of you have heard of this, but let's look at this picture. This is a picture of 100 different people. The people here that are in green are those that are immune to a disease, we'll say COVID, because they've either had it or they've been vaccinated. So that means that they're immune to it and they can't catch it. The people in yellow here are not immune, meaning that you haven't been vaccinated and they haven't had the virus either. So we have one person here who is infected. So this person can spread it to other people. But because there's so many people in the green that are immune to the disease, this person that's infected is isolated from these other people that are not immune. and therefore they're further away, and the risk of them passing on the infection to somebody who's susceptible is pretty low. So if you can imagine a bunch of people don't get vaccinated and you have a lot more yellow dots in this diagram, there's a lot higher chance for this red person who's infected to come in contact with one of these people that is not immune. That's why it's so important for everyone to get vaccinated. The more people we have that are green, the less likely it is that the infected people will spread the infection to those who are not immune. We've been all hearing all kinds of things about myths and scary things about the COVID-19 vaccine. And a lot of it really is scary and it's unknown. And I understand why a lot of people have a lot of questions about it. So I did want to answer just a few common myths that you hear probably a lot. First and foremost, again, the vaccine cannot make you sick with COVID. Does not contain any of the virus, and there's really no possible way for you to catch COVID from the vaccine itself. It again only contains the instructions for the protein on the outside of the virus. So it's really impossible for you to catch COVID-19 from the vaccine. Symptoms such as a fever that a lot of people get after the second vaccine usually are just your body's immune response reacting to the vaccine. So when your body makes these antibodies, your immune system is revving up and doing all the things it's supposed to do. And fever and sometimes not feeling well is part of that. And that's a normal response to the vaccine. And it actually means that it's working. And it usually only lasts a day or two. Second of all, getting the COVID-19 vaccine will not make you test positive for COVID-19. And many of you might be worried if you get the vaccine that you shouldn't be around people. It's okay. You're not going to pass COVID-19 on to anyone because you've been vaccinated. If you've had COVID-19 before, do you still need to get the vaccine? Absolutely, yes. We don't know how long the immunity lasts from the COVID-19 infection itself. Probably around 3 to 5 months, but it's really not known for sure, and everybody's different. The other thing that's been kind of scary is that the virus tends to mutate over time. The more people that become infected, the virus mutates along with that so that it can continue to spread. And so if you've had it once, maybe way back in like April or May, there might be new variants around now that you didn't have back when it was around in the spring. So you might just be as susceptible to it as you were back in the spring. So it's really important to remember to still get vaccinated even if you've had it before. Again, the COVID-19 vaccine will not affect your DNA. It isn't going to change your cell. It isn't going to make you grow another arm or leg. I've heard all kinds of different things about this. People are worried it's going to change their body in some way. It absolutely is not and cannot. Again, it only contains a set of instructions to make a protein to make antibodies against the COVID virus. That's all it does. It doesn't do anything else. And it doesn't go into your cell where your DNA is stored, so it can't alter your DNA. It's also important to know, and most people probably are pretty aware of this, that the current vaccines really require 2 doses. And it's important to get that second dose. Although you might have some immunity from the first shot, it's really not known how long that's going to last. So it's really important to get that second shot. And even if you can't get it within the 3 to 4 week window that you're supposed to, even if it's a couple months or a couple weeks later, it's still okay. It's just really important to get the 2 doses. And a lot of people might wonder, why do you need 2 doses? Well, when you think about it, a lot of our vaccines require 2 doses. So it's really not unusual for that. Just wanted to talk a little bit about how the vaccine is being distributed across the country because it's very confusing. It's very confusing for all of us, and I'm sure it's even more confusing for those of you who don't know what's going on. The vaccine has been purchased by the federal government, and then in turn, it is being distributed by the states. And because of this, we have a different distribution program in every single state, and they all have different ways of doing that, and that's making it extremely confusing for people. Right now, there's 2 vaccines that are in distribution. That's the Pfizer and the Moderna, and there probably will be a couple more soon. Both of these 2 vaccines are very, very effective. In fact, they're about 95% effective, which is really much higher than most vaccines. Most vaccines are only about 60 to 70% effective. So 95% is really amazing. Again, there's other vaccines that may become available soon. The Johnson & Johnson is currently being assessed for emergency authorization and hopefully will be available soon. And this is only a 1 vaccine shot. It has an efficacy of about 65%, which might sound a lot lower because the Pfizer and Moderna are so high, but this is actually a pretty normal effectiveness for a vaccine. So it's really believed that it's going to be okay. And again, the more people that have become vaccinated, the better. So there's a lot of hope in that vaccine as well. And it only takes one shot, so it will be much easier to distribute than the two that we have currently. When you do sign up for the vaccine, you will probably need to provide insurance information if you have it, because they are charging the administration fee. So that's the fee is assessed when you get the shot itself to your insurance. If you don't have insurance, it's okay. The states are taking care of that. But if you do, it's important for you to provide it at the time when you sign up. And each state department of health has their own distribution schedule and way of doing things. And so even within the same state, you might find differences between different counties or different cities. So even if you live in New York, for example, if you live in New York City and you have a relative that lives upstate New York, you might have completely different ways of getting the vaccine. So just be patient, and I'm going to give you some help at the end to show you how you might find some information on that. The vaccine distributions are changing all the time, so you just need to ask lots of questions, and I will give you some ideas on how to find that on the web so that you know what's going on. So who can get the vaccine now? Well, again, it's different in every state, unfortunately, which makes it very difficult for all of us. But in general, there are some categories that seem to be common in all of the states that are being vaccinated at this current time. So in general, most of the healthcare workers have been vaccinated across the country, and that includes anyone that works in hospitals, but as well as outpatient clinics, dentist office, eye doctors, people who might work in physical therapy, things like that, as well as all the nursing home workers and patients. In general, most of the states are now vaccinating people who are ages 65 and older. And a lot of states are vaccinating teachers, people who work in schools, colleges, bus drivers, people who work in jails and prisons, as well as police officers, ambulance drivers, firemen, people that work in public transit, and this might affect some of you, those that might work in an airport or work in the food delivery part of the airport may have some eligibility, and you might want to check with your employer or with the union on that. Other public transit workers, such as subway workers, people that work with the public bus system or trains, are also eligible. So these are the categories. If you think you might be in that, you should check with your employer. People that work in the grocery stores are also eligible, but there's other frontline food service working that may be eligible as well. Again, check with your employer and see if you fall into that category. And then people working or living in like homeless shelters or group settings where there's a lot of potential for spread are also being vaccinated. Now, people with chronic conditions such as diabetes, high blood pressure, obesity, smoking, most of you will be eligible soon. And every state has a different time frame for that. So it's important for you to check with your doctor when you might be eligible if you have a chronic healthcare condition. So how can you find out how to become vaccinated? The first thing really to do is to check your state vaccine site. And if you, we have some links here that I'm going to show you in a minute, but you can also just Google your state and the COVID-19 vaccine, and generally it will bring you to your state's website. However, the fund has worked really hard. So on our website, I'm going to show you, we have had a link so that you can go to all of the different states and try to find the information for your particular state, which I will bring for you in a minute. But always check with your doctor. If you have an underlying health condition, you're just not sure and you have questions, you always should check with your doctor about any health related questions that you need answered. Now I'm going to show you a link. So on our website, uhh.org/coronavirus, you can go to the main page and it'll take you to coronavirus as well. But if you go out to our website, you can see that we have these fund resources for COVID-19. We're going to click on vaccine. And then we'll go down and it lists all of the different states. And we'll just look at Massachusetts here. And then there's a lot of questions. So where can I get the COVID vaccine? So we're going to click on that. And You can see due to high demand, vaccination appointments are limited, and that's pretty universal everywhere. Most of the states are really limiting the number of people who can be vaccinated. But you look on this website and it will say steps to get your vaccination, and then you can just kind of follow use our tool, and it should walk you through it. It's asking questions. So it looks like in Massachusetts, you have to be 75 or older and not 65 or older. But every state is different. And so if you have questions, there may be people at the fund who can help walk you through it. You can check with your doctor, check with family members. But the important point is that it's really important for everyone to become vaccinated. And we are going to try and be a resource for you to help you as much as possible. And hopefully everyone can get vaccinated soon and we can get back to life as normal. Thank you.